Today, Congress passed the COVID relief bill without a single Republican vote, despite the fact that Republican voters in a majority support the package. And also, as I will get into, this is not a terrible bill. I almost hate to say it. I have spent quite a bit of time criticizing what is not in this bill. The $15 an hour minimum wage increase, not in the bill, taken out in the Senate bill, was in the House bill, passed, taken out in the Senate. And of course, checks are not $2,000 like they were promised initially. But to my surprise, and I'm going to guess to your surprise as well, there is actually a lot in here, especially in terms of direct payments and help when it comes to healthcare, which also surprised me. So before I get into more details on this, first I want to show you the support for this bill. So this from Morning Consult, high level of support persists for $1.9 trillion COVID aid package. You see here in terms of all voters, 51% strongly support, 24% somewhat support, leading to a big majority here. 75% of all voters say they support the package. But breaking it down further, especially when it comes to Republicans here, 29% strongly support this, 30% somewhat support this, amounting to 59% of Republican voters supporting Biden's COVID aid package. And not a single Republican lawmaker voted for it. Showing you the real disconnect between voters and lawmakers. Now, getting to details in terms of what is in this bill. Of course, as is highlighted already, $1,400 checks. Now, it's not $2,000, but if you are a family of four, this amounts to $5,600 because each child, as Common Dreams points out, each child also receives the same check. So $5,600 for the average family of four, making under $150,000 a year. That's pretty damn good. And that is also before the child benefit, which is also a new piece of this. Child benefit, $3,600 for the year. It goes out, I believe it goes out monthly. So it's $300 monthly. And it sounds like Democrats want to try and turn that into a sort of universal basic income. So this would be incredible. And by the way, other countries like Canada already have a child benefits that is similar to this. So this is not a completely new idea in terms of, looking at this internationally. But it is a great thing for Americans to now have access to. Also, let's see here. So $125 for billion for schools, $30 billion for public transit, $25 billion for rental assistance, $14 billion for vaccine distribution. Also, the $300 a week jobless benefit. It used to be $600, was cut down to $400, then $300, but now it's extended to September 6th. So that's also, again, in addition to the checks, the direct payments. Look, not too bad. Again, just to be clear on the direct payments, if you make under $75K a year, then you get the full payment. If you're a married couple, up to $150 a year, then you get the full payments, and it tapers off for both. And then and then each child gets $1,400 as well. Now, there's also another piece of this, which is the Obamacare subsidies. Now, this actually really surprised me because it's not single payer still, of course, but you're at a point now where if you make under a certain amount, and which is now increased, you're paying nothing when it comes to Obamacare healthcare premiums. And if you make, more, if you're the average income earner, you still are going to be paying a lot less of your income to healthcare, up to a max of 8.5% of your income. So nobody in the country will be paying more than 8.5% of their income to healthcare premiums. Now, because the American system is so convoluted, yes, there's the issue of, out-of-pocket expenses and other expenses, of course, medication. So, of course, there are other costs that are included with healthcare. But how it breaks down here, just as LA Times writes, for instance, people who make up to 150% of the federal poverty level, or $19,320 for an individual and $39,750 for a family of four, will no longer be required to pay anything toward their premium, based on the cost of the second lowest cost silver level plan for each region. Going down further, they give an example here. So for instance, a 21-year-old with an income of $19,320 who was eligible for a subsidy of about $3,500 under the ACA would get $4,300 under the new plan, assuming the cost of his benchmark silver plan is $4,300. So if you make up to $19,320, your healthcare premium is fully reimbursed. Pretty good. Now, of course, yes, that is the premium. There are other costs with healthcare, but still a clear improvement here. Also, another example here, an individual who makes up to $25,760 or a family of four that earns $53,000 will be required to contribute up to 2% of their income toward their premium, down from the 6.52% they pay currently. Again, this is a massive improvement from 6.52% of their income on healthcare premiums down to 2%. Massive benefit here. Says here the people who stand to benefit the most are those who make just over the poverty level, because their premium cost will go down to $0 according to several estimates. So, look, it's not a public option. It's not single-payer healthcare, but there are still obvious benefits here in this relief package that amount to people saving a lot of money, be it, receiving money in direct payments, direct checks, or saving money through healthcare costs. And by the way, if you want a deeper breakdown on that, you can check out Kaiser Family Foundation. I'll link to this below the video. They have, charts and graphs and a lot of details on this, how all the math works out. So there you go. Last thing here, just in case some of these points I didn't hit on yet. So this is what's in the bill. In addition to direct payments and child tax credits, the bill would provide $14 billion for vaccine distribution, $49 billion for COVID-19 testing, contact tracing, and personal protective equipment. It includes $125 billion for K-12 schools and nearly $40 billion for higher education. It would provide $39 billion in child care grants, $25 billion in rental assistance, and $30 billion for public transit as well. So there is a lot in this bill. In fact, the majority of the money in this bill is for the average individual, is for the people, not corporations. So, clear difference from the Trump bills. And look, this is why it has so much support. I mean, when people are told what is actually in the bill, they support it. And I think a lot of what is in the bill, people aren't even aware of. And they're one day going to check their bank account and be shocked that they see a ton of money in there that was given because of whatever, whether it's the direct payments, whether it's unemployment, whether it's the fact that their children are also receiving the money, or the child care benefit. A lot of benefits here in this bill. Yes, I wish the wage increase was still in there. It's going to be impossible to pass that without budget reconciliation or getting rid of the filibuster. But despite that, there's a lot in this bill, and it's important to acknowledge and take the wins when you get them.